How come we say? You know, I couldn't let you just be by yourself.
Oh, thank you.
I wasn't gonna. You can't have all the fun in Rwanda.
Good.
We have. Where's our guy?
He's coming.
He's
He
coming.
is
That's amazing.
coming.
How many people are here from
How did the other
actually
sessions go?
from Rwanda?
I see many Rwandan names.
Yeah,
Yeah.
that's nice to see everybody.
Yeah.
We're gonna
Nice
make you a co-host.
background.
Do you
Sure.
miss home? Do you miss home at all?
Yeah. Very much, especially now that it started snowing in Quebec.
Oh, it's
So I
snowing.
absolutely miss some sunshine.
Oh yeah. Actually, I think we can say that the best weather in the world is in Rwanda. It has the best.
Oh, I absolutely agree.
It is insane. And I tell people, it's like if you're in a place where the weather is beautiful every day, it just feels good.
Yeah. Yeah,
And I used to
definitely.
joke and I kept saying, it's like, this is the best day of my life.
Yeah.
The best weather I've ever had. And then it's every day is the best weather I ever had. Of course, I live in New York and now you're in Quebec. So it's like, it doesn't take much.
Yeah.
Anyhow, it's good to
Yeah.
see you. Good to see you awake and good to
Yeah.
see so many
You
faces.
too.
And
Yeah.
cool. Where's Kiza Blair? I'm wondering, he was here before. He was helping us. Oh, they're taking a little break. Okay, well, that was us.
Oh, okay. Where are they based?
I think some in Uganda, from
Oh.
Uganda, and the medical school in Uganda. It would have
Oh,
been nice
okay.
to see. It would have been nice to see some of our old friends there. But hi, Monique. Is she awake?
Yes. Oh, she says she's from the
Yes.
Netherlands.
Good
Hi,
morning.
Monique, and I'm glad to see you.
Hi, I'm happy to meet.
How did you find us?
I was invited by Freddie
Oh,
from
nice,
Amegerwa. We work
Oh,
together,
nice.
so that's why I'm here today.
excellent.
So
You know,
curious.
we were in Rwanda in 2018.
Oh,
And
me too. Yeah.
and we were part. Were you there for the international conference?
No, I wasn't. No.
Anyhow, it was a really an amazing time in Rwanda. I had lots of adventures, and I'm a very stubborn person, so I always believe if you just don't give up, you only lose when you stop trying.
Exactly.
As long as you keep believing something's possible, it's still possible. And I think I think I still think Rwanda is the country with the most potential among many of the African countries. It's a manageable size, and it could be it's got so much going for it. And when you look at Kigali and just how beautiful, it's just perfect.
Yeah, I also love the people, not only the country.
Oh, the people that's what makes a country.
Yeah.
So when is Freddie going to join? Is he want to make those kind of beautiful entrances that he makes?
Yeah, probably.
Otherwise, it's going to be on you happy. Yeah, the one
Yeah.
thing we're hoping he come because he's so enthusiastic about doing things.
Yeah.
So we want to make sure he shows up for his own event. When did you talk to him?
Like 10 minutes ago.
Oh,
Yeah. We have more students joining us. That's
nice.
good. Than letting people in.
Are you the one? Are you managing? Are you the co-host?
I believe so. I'm letting people in.
Yeah, there you are. So do you think now that you spent, how long are you going to be in Quebec for?
2 years.
Without going home, or do you get to go home once?
It depends on my research project. All depends on Michel.
Really, you should be nice to him.
Yeah. It depends on when he decides we're going to do our research. If he decides that we do it next year, then I can't leave.
Where are you going to do the research?
in Quebec. We were supposed to do a research in Haiti, but with the current situation, it's too risky. I can't travel there.
Right.
So we're doing one through his clinics in Quebec.
Okay, that's convenient.
Yeah. It's
What is the topic?
we are actually pretty interesting. We are doing something on decision making, like making a decision aid tool for patients that just had their vasectomies to come for a semen analysis.
Huh.
Yeah, because although the failure rate is very minimal, it's like 1 in 1,000 patients, but that would potentially result in an unwanted pregnancy. So they want to reduce that to 0, essentially. But then that's possible for people that come for their semen analysis, because they're able to find people that they're like now like reconnect, or it takes time to properly heal. But then they can know that in people that don't come to do their semen analysis. So they want to create decision aid tools to really for patients to be aware of the risk they're taking when they don't come for their semen analysis.
I got a vasectomy and I never got a semen analysis.
Uh-oh.
You want to know why?
Why?
Because the 1 in 1,000 chance just didn't make it worth. I'll tell you why. This is the truth. Think of this. To get my sperm analysis, I calculated there was a 1 in 500 chance I would be hit by a car, versus it was a 1 in 1,000 chance I'd get pregnancy. So I was like, I did the analysis and realized it was safer to stay home.
Yeah.
It's not for 1 in 1,000, you know. And I figured if I got pregnant in the 1 in 1,000, then then that's what God wanted.
Oh, I don't know.
Hello, Anisette.
Oh, hi. And Freddie is here.
Oh, excellent. Freddie, Anisette, you work with me all that time. You have to put the light in your face. You got to turn around so we can see your face. Come on, turn around. We're going to see that face. I feel it.
Oh.
There we go. He's got that.
Nice. We can finally see you. We can't hear you. You're muted.
It's good. But look at that, man. He's got the beard. He's got a whole new look, man. We can't hear you, Anisette, but if you're saying something nice, you got to put the sound on. If you're not saying something nice, keep it muted. Where's Freddie?
Oh, he's there.
Lost him? There.
Looks like they are in a vasectomy event.
Hey, Anisette, you got to turn your mic on. Oh, Freddie.
Hi, Freddie.
Hello, Jonathan. How are you?
Very well. Good to see you,
nice
man.
to see you.
Nice to see old friends and faces. Good to see you, everybody. Nice to see everybody who's here. Are you letting people in?
Yes.
Happy? Okay.
Yes.
All right. I'm going to put the mic over to your hands, Happy, and then I'll follow your lead.
All right. Thank you. So welcome, Freddie and Anisette. Maybe we can start with Freddie introducing himself and maybe talking about the event and his background.
Thank you. Thank you, Jonathan and the team. Good morning for everybody. As you see, Amegerwa, we are here today. We have a meeting in collaboration with Kiwagabaga Hospital on discussing on the role of men in family planning, specifically vasectomy. I'm not alone here. I'm with one couple who will give a testimony about vasectomy. I'm with someone in charge of family planning, specifically with health workers, community health workers in Kiwagabaga Hospital. And I think Dr. Peter, who did vasectomy operation, will join in a few minutes. So, as you know, Amegerwa is working together with Kiwagabaga Hospital to speed up family planning progress, specifically vasectomy. During these 2 weeks, we had a vasectomy for 8 men, and even today we are waiting for 3 men who will come in afternoon. This meeting, today we have a meeting with all community health workers from each health center so that we discuss on the way forward and how we can improve our intervention so that we speed up, we increase the number of men who are involved in family planning, specifically in vasectomy programs, or in collaboration with Kibagabaga Hospital. So today we think we'll get some new idea from Dr. Aruiz, who joined. Hello, Dr. Aruiz. He's there. He's the owner of private clinic, which would like to integrate family planning in their program, so that even those who think uncomfortable to go at health center for getting vasectomy services can join his private clinic for getting vasectomy services. So if your own Anisette can also make his introduction.
Sure. Thank you so much, Freddie. Just for clarity for the people joining today, Kibagabaga Hospital is one of the, I think, one of the big regional hospitals in Kigali, in Rwanda. Yes, just for context. So Anisette, over to you.
Yeah, thank you. As you know, I'm Anisette Nzabonimpa. I am a medical doctor with a big experience in reproductive health, especially in family planning. And as you say, I'm wearing the World Vasectomy Day t-shirt. So I'm very, very interested in promoting vasectomy services, especially in my country, in Rwanda, where since 2008, we started the no scalpel vasectomy in the country, and especially in 2010, with Dr. Michel Abrek from Canada, we introduced the new technique, no scalpel vasectomy with cautery. And now in Rwanda, we are still working on community awareness. And as a medical doctor, working a long time with the Ministry of Health and Rwanda Biomedical Center in Rwanda, in family planning program. And now, as an advocate and activist in reproductive health, I'm still working on community awareness and community mobilization around family planning, and especially for vasectomy. I'm working with some civil society organizations, including Rwamurek and the Amegerwa and the others, to ensure that we can help the Ministry of Health on the demand side, because health facilities are there providing services, but we have to ensure that the community is aware and motivated to go to their facilities for vasectomy for services. So now I am in the Western Province near Kivu Lake with people from Karongi district in training on gender-based violence. And in this training, we really talk about male involvement in reproductive health, especially in family planning. And people are mobilized that many can also help their partners, their wives too, to use family planning, especially to have vasectomy as an act of love in couples. Thank you very much.
Thank you so much, Anisette, and thank you for making time to join us today. I'll pass it over to Freddy.
Yeah, thank you, Happy. As I told you, I was someone who have get service of vasectomy, who can give his testimony on how he feel now and how they take decision of getting a vasectomy. He's with his wife. Maybe I can pass him the.
Sure. I can do the English translation, but you can have the Kinyarwanda conversation with them. I'll just do the translation.
He will intervene in Kinyarwanda, and then, as Dr. said, he will make his intervention in Kinyarwanda, so you will explain to Jonathan and the others.
Okay, thank you.
Mwaramutse.
Mwaramutse neza.
Nitwa Hategekimana Gervais.
Yego.
Nitwa Hategekimana Gervais.
Yego. Nanjye nitwa Kampire, ndi umunyarwanda, nkaba mperereye muri Canada, ndi umunyeshuri, kandi nkaba nkorera World Vasectomy Day. Twifuzaga ko tubwira uko
nta kibazo kirimo, baranyakiriye bankorera neza, gahunda yose y'imibonano igenda neza, nta kibazo kirimo.
Ese uru rugendo rwo gufata umwanzuro wo gukora vasectomy, watubwira muri make uko wowe na madamu mwahisemo kuza gukoresha ubwo buryo?
Twabiganiriyeho, noneho ndavuga turabyumvikanaho, ndamubwira nta kibazo, reka bari njyewe bakorera, kubera ko abadamu bagira imirimo myinshi, akenshi bakunze kugira imvune nyinshi. Ndavuga ni njyewe nta kibazo, reka bari njyewe bakorera, numva nta kibazo cyaba kirimo.
Okay, byiza cyane, murakoze cyane. Freddy, do you have any more questions?
Genda yadufasha akatubwira, hari igihe abantu bavuga ko iyo umuntu yahawe iyi serivisi ya vasectomy nk'umugabo, hari uburyo ibijyanye n'imibonano mpuzabitsina bihinduka, akaba ari amakuru ashobora kuba atari yo, ariko nkawe waba warabonye serivisi, niba hari icyo yatubwira.
Ku bigendanye n'imibonano nta gihindukaho,
abagira iyihe nama cyangwa bahereza ubuhe butumwa?
Abagabo ubutumwa nabaha ni ukugira ubwoba bw'ubusa, kuko ibintu byose akenshi tubihereza ku bagore. Abagabo bakagira ubwoba ngo bizagenda nabi, ngo imibonano ntizakorwa neza, ariko njye numvishe nta kibazo, nabatinyura ntibagire ubwoba bwabyo, nta kibazo biteye.
Byenda uri kumwe n'umufasha wawe, nawe byenda yagiye yumva amakuru asa n'avuga ibijyanye na serivisi ya vasectomy, hari uburyo yayumvise ari ay'ukuri n'ayo kubeshya. Wowe kuri uyu munsi we yatubwira iki nk'umuntu muri kumwe?
Murakoze, nitwa Nyirahabineza Clementine. Murakoze, nitwa Nyirahabineza Clementine. Uko babivugaga koko natwe twumvaga ariko bimeze, ariko tukimara guhitamo ubu buryo twasanze ari ibisanzwe, nta mpinduka ibaho, n'ubundi ubuzima burakomeza nk'uko bisanzwe, nta kibazo bitwaye.
Ni ubuhe butumwa wahereza abandi badamu, cyangwa n'iki watangariza abantu bari bafite amakuru atari yo ku bijyanye na vasectomy?
Nabashishikariza ko ntabwo abagabo bakwiriye kubiharira abagore gusa, bumve ko ari bo bagomba gukoresha uburyo bwa burundu, ahubwo n'abagore n'abagabo twese biratureba, kandi bashira ubwoba rwose, nta mpinduka ibaho idasanzwe, ubuzima burakomeza.
Murakoze cyane. Happy rero urumva ko abatangabuhamya bacu mu by'ukuri hari amakuru atariyo abantu bari bafite ku bijyanye no kwifungisha burundu kw'abagabo. Nkaba numva ibi ngibi byafasha, ariko nk'uko twababwiye tugiye kugirana inama n'abajyanama b'ubuzima kugira ngo turebe uko twashyiramo imbaraga muri Gasabo, bityo bizamure imibare yo kuboneza urubyaro. Jonathan, sorry, I was speaking in Kinyarwanda according to what our guests come to tell us. So I would like to invite Dr. Alois.
Sorry, let me just translate what they said so that people in the audience can just know. So we first asked our patient, I think it's Gervais, how his process, how his the surgery went, and he's really happy with the results, and there was no pain, so he really liked that it was a smooth process and he didn't have any complications. We also asked him about the misconceptions around vasectomy, for that it affects sex drive and sexual intercourse as a whole. And he says that sure, he had heard about these misconceptions in the community, but he would like to say to everyone who's attending today that these are not true because he himself did not face this kind of issues. And we also asked the wife about like what she had heard in the community, and it's the same thing, that most of the misconceptions around vasectomies are really around sexual drive and how it affects sex. And as a message to future people that wants to get vasectomies, they're saying that it's a safe, effective method, and they're really happy that they opted for this one instead of a hysterectomy, because they feel like it's a way to contribute to making decisions for their family instead of putting all the weight on the wife, and the husband is stepping in to also participate in taking care of his family. So sure, we can, sorry, Jonathan, you have raised your hand. Go ahead.
Well, I had a question for the couple, which was, why do you think, what would need to happen so that other men like him and his wife or couples would make the same decision? Like, obviously, the myths and misconceptions are not correct. So what do we, if there was the right information, do you think people would make the same decision?
Freddie, would you like me to translate?
Yeah, you can do.
Sure. Jonathan yarabajije ati ese mwumva hakorwa iki muri community kugira ngo abandi bagabo nabo bashishikarire gukora vasectomy.
Arabaza ngo niki cyakorwa muri community kugira ngo abagabo bose babashe kumva ubuzima, kuboneza urubyaro nk'uruhare rwabo ndetse no kuringana no kwifunisha burundu. Niki dukeneye muri community? Niba ari umujyanama w'ubuzima muri adufasha, yaza akadufasha gusubiza. Oya, wowe banza, ngwino hano. Happy, reka umujyanama w'ubuzima adufashe nk'umuntu uri muri community, atugire icyo twashyiramo imbaraga.
Murakoze, nitwa Kwizera Neko. Icyo mbona gikwiriye gushyirwamo imbaraga kurusha ibindi, cyane cyane no kwigisha ubuzima bw'imyororokere, kuko ibijyanye yenda n'imihindukire y'umubiri mu gihe cy'ubugimbi n'ubwangavu umuntu aba abizi, ariko ibi bijyanye n'uburyo bw'ubuzima bw'imyororokere, cyane cyane ku bijyanye n'isama n'itwita, usanga rimwe na rimwe imyumvire ihari. Ikibazo gihari ni uburyo ni gute, yenda mfashe nk'urugero ku buryo bwo kuboneza burundu, ni hehe intanga zihurira n'amasohoro. Ni nacyo kibazo ubusanzwe gihari, kuko abagabo benshi bazi yuko iyo bakoresheje uburyo bwa burundu bagira n'ikibazo ku bijyanye n'imibonano mpuzabitsina. Mbona rero ikintu gikwiriye cyane kurusha ibindi ari uburyo bwo kubanza kwigisha cyane cyane abagabo aho bihurira. Ni gute ubuzima bw'imyororokere bushobora gukomeza mu gihe umuntu yaboneje urubyaro mu buryo bwa burundu. Numva iki ngiki aricyo cy'ingenzi cyashyirwamo imbaraga cyane cyane mu kwigisha abagabo. Murakoze.
Murakoze cyane. So this is Nepo, a member of the community. Sure. Okay. I'll just translate real fast.
Okay.
So that's Nepo, another member of the community, and so he says that in this community they need to invest more into reproductive health education and to involve heavily men because they're usually not part of these conversations, and to really highlight what happens in the conception of a baby. So really being more specific on the work of a sperm and the work of an ovary and what happens in the process, and to talk about specifically as well what happens when a vasectomy is done and how that affects that process, and really highlighting that it does not affect their sex drive, and also like really involving men in these conversations. So yes, that's my short translation.
Yeah.
Thank
Can
you,
I just say
Aki.
thing?
We can.
Oh,
Sure, go
We
ahead.
can have another intervention for Mr. Teofil.
Okay.
Sure.
Teofil, 1 minute before we welcome Dr. Royce.
Sure. Thank you.
Murakoze cyane. Nanjye icyo navuga ku byatuma iyi serivisi yitabirwa n'abagabo ikinyuranye cyane n'icyo mugenzi wanjye yari amaze kuvuga, ariko kijyanye ahanini n'inyigisho n'uburyo zitangwamo. Dufatiye urugero nko ku buryo abagore babwirwa bigishwa ibyerekeranye no kuringaniza imbyaro mu buzima bwabo, usanga abagore batwite bajya kwa muganga bagiye kwipimisha, bafite aho bahurira n'izo nyigisho mu buryo bukomeye. Ugasanga abagore barigishwa, ariko abagabo ntaho bahurira n'inyigisho ku buryo nabo babasha gusobanukirwa mu by'ukuri n'ibijyanye n'ubuzima bw'imyororokere yabo n'uburyo bagira uruhare mu kuringaniza imbyaro. Hakwiye kubaho rero uburyo bigishwa mu midugudu yabo aho batuye, cyangwa se no mu manama, hakabaho kampeni ihariwe abagabo mu by'umwihariko bagasobanurirwa ibijyanye n'iyi serivisi ya vasectomy. Kuko nanjye ubwanjye nari mfite impungenge zo kuvuga ngo ese umuntu wakoresheje ubu buryo yabasha gusabana n'umugore mu buryo bwuzuye koko bigakunda. Ariko nkurikije ubuhamya mbashije kumvira hano, biragaragara ko abagabo benshi batarasobanukirwa kimwe nanjye, wenda baracyafite intege nke mu myumvire. Ntekereza ko hakwiye kubaho rero uburyo tubasanga bakwegerwa aho batuye bagasobanurwa mu buryo bwimbitse. Ni ikintu nashaka kuvuga. Murakoze.
So he was just adding on what the other members said. So he's saying that in this community that the women have a way to get this information, especially when they start planning to have children. So during the whole process of the pregnancy, they meet with healthcare providers and they get information on birth control and all the other important things to take into consideration for their families. However, these conversations don't necessarily involve men, and they think that there is a disparity in how this information is shared with both members of the family, both parents essentially. And he suggests that there should be done more sensitization at the community level involving men or only for men, so that these kinds of conversations can be had. So Jonathan, I see you raise your hand.
Well, I was thinking two things. One, I was listening today to FP 2030. FP 2030, as we know, is the largest UN, or it's the world global organization that sets the standards for family planning and sexual and reproductive health in the whole world. And I listened to today was the first, they announced the standards for 2030. And it was like a 2-hour conversation, and they never once talked about men. It literally said women, adolescent girls, and people of diverse gender, but not men. It was literally everybody but men. And I think that we often blame men for not participating, but the reality of it is the family planning world spends very little money, very little time in educating men. And I just want to add And my father in New York, he never talked to me. I didn't get information from my father. I got it from my friends if I got any information. So I learned because I was interested, but didn't come from anything. And I think that we should put less blame on men. There are a lot of things we can be blamed for, so I understand, but we should put more resources to educate men. I agree 100%.
Yeah. All right. So I will pass the floor to Dr. Alois or Dr. Peter, whoever is in the room, to tell us more about the challenges and the success stories in Rwanda in the provision of vasectomy services. Yeah, vasectomy services.
Dr. Royce, maybe he's not connected.
He was
And
here.
did you talk with him?
Yes, I can.
And you can share with us.
Yeah. You can lead the conversation. You're the expert.
Yeah.
Yeah.
So let me talk about the community engagement in family planning in general, and specifically on vasectomy. Just to let you know, in Rwanda, we have a very strong community health program. And in our community, we have community health workers in all villages, and we have two categories of community health workers. We have the first category is what we call the norm, a man and a woman working in both programs. And the second category is a maternal health community health worker, focusing on maternal newborn related issues. But specifically for family planning, we have this one in charge of maternal and newborn health, and sometimes one or two, the man and the woman doing everything. At least two health community workers at each village are trained on family planning. What they do, they are skilled to give counseling, to educate people, and to provide family planning services, including condom distribution, provision of pills for contraception, and also injectable. For vasectomy, community health workers help us to mobilize men, to have accurate information in vasectomy, to have information on how vasectomy is done, benefits, and how the procedure is done in health facilities, and how services are provided in health facility free of charge. And then what they do is just to go to make a kind of a door-to-door visit, to mobilize especially men and boys on positive masculinity, because not only on family planning, but for all maternal child health services and the other reproductive health services, the community health workers mobilize men to help women and children to have access to services, especially to ensure that at the family level, everyone have access to health services. So in addition to community health workers, we have in our communities local leaders. Local leaders include local authorities at the lower level, and among those local authorities in Rwanda, we have a specificity of having at least 30% of local authorities are women. That reason why in Rwanda we are promoting this gender balance, but also in the gender balance program, we ensure that men also support the promotion of gender balance, and also men can also be a agent of change for to support women to have access to all services, including health services. And at in the family planning program, we encourage men to accompany women to family planning services, and also to have a couple counseling together, and then, if possible, men to accept to use vasectomy as a family planning method. We have also religious leaders, and at the community level, religious leaders play a big role in community mobilization. They have especially three programs. One is the promotion of parent dialogue between women and women at the household level. And then with effective dialogue between partners, so they can choose effective method of family planning, including vasectomy. And there, we have also another program, parents and adolescent communication, where we religious leaders promote the discussion between parents and the children, especially adolescents, to ensure that those adolescents have information on reproductive health, including family planning, and also the promotion of positive masculinity among adolescent boys in the community. Also,
Hello, Dr.
we have some
Dr.
specific programs on the promotion of family harmony, where men and women can discuss about which effective method of family planning they can use. And there, vasectomy is the one among the key topic discussed at the community level and in the different churches, except Catholic churches. We have also.
Sorry, I think
Yeah,
Freddie is trying to say something.
Yeah, Dr. Alois is online. Maybe
Oh.
he can intervene about private sector, private clinics in family planning promotion. How private sector can intervene, can have a role in family planning. Dr.
Yeah,
Alois,
Dr. Alois, you're muted, so I can.
Good morning, Dr. Alois.
Morning, sir.
Long time. We keep in touch.
Yeah, it's a long time. Okay,
Yeah.
do you catch me?
Yes.
Okay, so happy. I'm so happy to be with you. My name's Dr. Alois. I'm working in the private sector. So I'm a private doctor and I'm a family planning national trainer. I have been working on family planning more than 10 years ago. But among the methods they offered to my clients, there is a vasectomy, no scalpel vasectomy. I have been trained by MOH on vasectomy, and I have performed more than 100 vasectomy. So my experience in private sector, family planning, and especially where vasectomy is performed, no scalpel vasectomy. So to mean that, in private sector, we offer a service of body.
No, you're good.
Yeah,
Happy-
sorry, I think we just lost Dr. Alois for a second there.
I'm really-
and rapid service. There is no time. This is for private sector. And there is in some area, a lot number of people at the health facility in public sector, but in the private sector, there is really a discretion. So we would like to promote vasectomy. Myself, I'm trained, but I'm not performing vasectomy. While I have some demand, some people are asking me vasectomy. So I'm not able to perform it because of no material. I'm the one to be trained at my clinic. So it should be better to increase the number of trained staff, medical and nurse, medical doctor and nurses. So it should be better. Then there is another challenge, material. We have no equipment for vasectomy. Myself, I'm feeling in need of refresher. So those are the challenges we are facing. Thank you.
Thank you very much for sharing. Jonathan, do you have any questions?
Do I?
Yeah, it seems like you had one.
I do, because I'm really curious about two things. One is, to what extent is the public sector committed in terms of putting resources, money for vasectomy programs? And then the other question is, what is the status in Rwanda for opening up a private vasectomy clinic? Is that even feasible? Like, would it be financially feasible, or would it still have to be funded by through the public system? You know, could you translate that? Happy?
I think Anisette can hear you, and he can.
But I want
probably
everybody
more.
make sure. Oh, okay.
Yeah, yeah. I think Anisette, do you mind telling? You're muted. Do you mind answering those questions?
Yeah. So I think, thank you, Jonathan, for the good questions. And what I can say in Rwanda, because now I'm now very, very involved in the public and the private health facilities, because in my work now with RBC and the Ministry of Health, sometimes I go in the public health facilities for some activities and trainings, but also once a week, especially every Saturday, I have some clinical activities in some private clinics in Kigali, around Kigali. And as I said, Dr. Alois, some private clinics have trained doctors. Some of them continue to perform vasectomy and others not, meaning that perhaps at the private sector side, they need perhaps a specific training for them in order to integrate vasectomy services in their routine work. But also, as I know, we have some motivated clinics ready to initiate a vasectomy program. I know Dr. Lois is really committed with his clinic. And I know other two clinics, one clinic I work with, and they are really interested to initiate a vasectomy service there. But the challenge, what they need is a kind of support in terms of trainings for doctors and nurses to perform nostroscopy vasectomy. And also the other issue is the equipment, the kits, the vasectomy kits. We need the vasectomy kits in order to be ready to perform vasectomy. So the initiative, the motivation is there, and I think what they need is just to help them to initiate vasectomy services in those clinics. We can now perhaps in Kigali 2 or 3 which can be ready to initiate the program as soon as possible. Thank you.
Thank you very much for that intervention. Does anyone else have any questions in the audience?
Yeah, I do, of course. I have a question. Here's my thing. Everybody knows that World Vasectomy Day was in Rwanda in 2018. And the timing was very difficult. You know, you had a big conference and it was very difficult to bring on another activity. And I think I made a bit of a mistake in that I didn't give up when I was told we shouldn't do it. And so I pushed really hard to make it happen because we had started and it was really going well. I really believed, Anisette, that if we were able to continue, I think today we would be talking about Rwanda as the center of vasectomy in the world. The problem I have right now, and it's not me personally, because I don't, like I said, I believe you just keep trying, but it's harder for me now to mobilize resources in Rwanda because I mobilized a lot of resources and it didn't work out. Now people feel like, oh, is there really interest in Rwanda or will they close it down again? Now, I think a lot of the problem was my own mistakes. So I don't think it's very simple, but how can we start something again, build it? Like, do we get it through the government? But if we're going to do it with the government, I have to make sure the government really supports the project on a high level. If we're going to do it in the private sector, which is, I don't have an opinion on, but if you choose the private sector, we have to know that the private sector can function well within, that it's something that could work. If I'm happy to continue to find a way to make it work in Rwanda. And I can speak for, there are a lot of people who would come back to Rwanda and try again, but we would need to know for sure that everything is approved on that high level so that, we don't end up making a mistake again. And I'm just wondering if the new Minister of Health on that level is really committed to vasectomy. If that would be awesome, that would be great if he is. Can you keep, what do you think? Or do you think it's better to do a private practice?
Yeah, I can also say something in the past. Dr. Ruiz will add something. What I can say is just, as said Jonathan, what Vasectomy Day started just this idea in 2018 during the International Conference on Family Planning. And just was just a kind of mistake between the what Vasectomy Day and the Ministry of Health. But I think now, according to my experience, I see it now, the private clinics, the private sector is better in the right position to provide vasectomy services to the community better than the public health facilities. You can ask me why. The why is vasectomy is a specific service, especially it requests a kind of pre-service counseling and also the post-service follow-up. And I think in the public hospitals, this kind of time to spend on counseling and also to ensure that after the service, the continuation of follow-up can be effective is not there. Because, in the public health facilities, with a shortage of health professionals, they don't have enough time to spend on each client, especially those family planning clients who need really much time to discuss with them to ensure that they are they have accurate information and also a good follow-up. Because, you know, in family planning and the last 2 weeks, I was discussing with people from RBC, especially people from maternal and child health and community health program, and the people from mental health division. And we were talking about some cases with some mental health issues after having family planning services without effective counseling. So that reason why we have to ensure that perhaps in the private clinics, they have enough time, because I know even me, when I go for some clinic activities in the private clinics, I have more time and have because I have a few people and also health doctors are many in the private clinics, so they can just have enough time to do counseling and to ensure that the post-service follow-up will be done. So I think to make it operational, what to do? What to do is just perhaps to have those motivated clinics and then discuss this and then make them responsible to work with the Ministry of Health, with the government. Because even if before they start the activities, they have an approval from the government to run the private clinics, and then for each activity they initiate, they have approval from the government. And then for me, I think which is better is to give the floor to the private clinics. We support them technically or financially. They run the service and they request the approval from the ministry as they do for initiation of other services. I know for some services, for some private clinics, they started they wrote to the Ministry of Health to request to initiate family planning services, including vasectomy. And I know in the case they have perhaps people trained to run the service, so they can get perhaps the authorization from the ministry to perform this service. So I think the most important thing is to ensure that in those clinics they have trained doctors and nurses to perform vasectomy and to ensure this pre-service and post-service follow-up.
Happy?
Yes.
Did you understand everything? Because we're going to expect you to write up a report to explain, because I think I don't know exactly what all that means in terms of the logistics, but I think if a really smart plan was written up that was really clear and it was understood what the costs are of it, how much money would it cost? How many doctors do we need to train? Maybe we just need to train one doctor to begin with, right? Because the demand isn't that big. But imagine a clinic with one really good doctor and then a really strong demand generation program. I guess my question would be is, how much money can you charge in a private clinic for a vasectomy? You know, is there a market for vasectomies in the private sector? I'm just curious if any, if that's been like, what could you charge, and would there be people for it? Basic business 101. But could you, I'm just curious. And maybe Ominde, are you there? Is that Japheth?
Yeah, that's him. Yeah.
Hi, Ominde. Don't be shy.
I guess one additional question that I had was, it sounds to me like there is a lot of ambiguity about around what's actually needed to promote vasectomy. Is it a funding problem? Is it a awareness problem? Is it a provider problem? Sounds to me like it's a thing we can just find out by doing research. We just need to find out what people actually need. Do they need more knowledge? Is it that they don't know about the service at all? Or is it because people do not feel safe to get the service? Is it because they don't trust their providers? Is it because it's not covered? They think it's expensive? I think we just don't know what the barrier is. At least the top 3 barriers. Maybe Andy said I could be wrong, and you could shed some light on that.
Yeah, you are right, Yapi.
Yeah.
You are right. And I think we can make things very easy by perhaps, so I know like me, like Freddie and Alois, we know our country and some health facilities, the private clinics, we know them very well. I think we can make a kind of, I can say, is a plan, a kind of a simple plan, perhaps to have perhaps 2 clinics, not many, just a kind of a pilot. Perhaps we can have 2 clinics, we contact them, and perhaps we can even schedule a Zoom meeting with you, with Happy, with Jonathan, and then to let you perhaps have their views and their commitment to work on vasectomy, and then to let them express themselves, and perhaps to know really what they need and how they can make a kind of commitment and pledge to run vasectomy service in their clinics. Because I can perhaps say something, Freddie can say something, but for me, I really need, if perhaps those we can have perhaps 2 who can express, who can say themselves, we need to run vasectomy service, and what we need is A, B, C, D.
Yeah.
Thank you.
Let me just finish, and then I'm going to pass the microphone over. We'll just conclude, and we'll be getting up to 3 o'clock. But one thing very concrete, very solid offer. If you could put together a couple of people and a set who you feel would be interested in that idea, and what they need is some basic information, like what do you need to have to start a clinic? I will find the people who will help you. You know, there are people who work with World Vasectomy Day or that we're associated with who have the answers to all that you want to know to be able to help you set up a clinic, or at least conceive of a clinic. And they will ask all the right questions, and they'll help guide you on that. And I think if you want to do that, if that's what there are people in Rwanda who are interested in that, I can find people who would be very much interested in helping you. So maybe what we should do is set up another meeting, not now, for World Vasectomy Day, and not now at 2:58 in the morning for me, but I think at another time we could really set up something and see if that's possible. Maybe that's an interesting model and it could work in Rwanda. But in the meantime, I'm going to thank you, Happy.